pit stop before we begin. Please subscribe, like this episode, and comment with the next community medicine topic you want. Those 3 taps help a lot. Done? Great, let's dive in. Welcome to episode 9 of Case-Based Scenarios on non-communicable and occupational diseases. We will connect lifestyle risk, clinic decisions, and workplace controls so your answers score in theory and viva. Dr. Joshi, thanks for joining us.
Glad to be here. 2 program anchors to quote in exams. The National Program for Prevention and Control of Non-Communicable Diseases, spelled NP-NCD, renamed from NP-CDCS, and the India Hypertension Control Initiative, spelled IHCI. Both drive simple protocols and a target BP less than 140 over 90 millimeters of mercury in primary care.
Scenario 1. A 40-year-old sedentary obese man, chronic smoker, BP 150 over 100 millimeters of mercury. How do we classify and what is the management, especially lifestyle with dash and habit cessation?
Classification first. Using the JNC 7/WHO ISH style bands still common in Indian texts, stage 2 hypertension is when either value reaches the higher category. Diastolic 100 places him in stage 2. In program practice, IHCI, diagnosis is confirmed by repeated standardized measurements and the target BP is less than 140 over 90 for most adults. Management spine, write it as A, B, C, D, E. First, assess. Confirm BP on at least 2 occasions, check cardiovascular risk, fasting glucose, lipids, creatinine, and look for end organ involvement. Link to NP-NCDs for follow-up and drugs. Second, behavior change, high-yield bullet list. First, DASH pattern, vegetables 4 to 5 servings a day, fruits 4 to 5, low-fat dairy 2 to 3, whole grains 6 to 8, nuts and legumes 4 to 5 per week, limit saturated fat and sweets. Sodium aim 2,300 milligrams per day, consider 1,500 milligrams per day for greater BP fall. Weight, target 5 to 10% loss if overweight, waist reduction is exam credit. Physical activity, at least 150 minutes a week, moderate intensity aerobic plus muscle strengthening. Third, tobacco cessation, brief advice, set a quit date, offer pharmacotherapy and referral to National Tobacco Control Program resources. Alcohol, none or minimal, if taken, keep within low-risk limits. Choose medicines per simple protocol, thiazide or thiazide-like diuretic, long-acting calcium channel blocker or angiotensin receptor blocker or angiotensin-converting enzyme inhibitor. Start 2 drugs in stage 2 or if more than 20/10 above target. IHCI emphasizes standardized drug combinations and regular refills. Dispense and document fixed dose combinations improve adherence, schedule monthly follow-ups initially. Escalate or refer if resistant BP, secondary causes, or complications. Pause and recall. The single diet step that most consistently lowers BP? Answer, reduce sodium within the DASH pattern.
Scenario 2. Raju has worked in the paper industry for 22 years. Non-smoker. Now, cough, chest pain, hemoptysis for 2 months. What is the most likely occupational condition, differentials, and prevention advice?
In paper and pulp settings, exposures include paper and wood dust, bioaerosols from wet pulp, chlorine compounds, sulfur dioxide, and cleaning agents. The picture suggests an occupational lung disease. Top possibilities are chronic bronchitis or occupational asthma from dust and chemical irritants, hypersensitivity pneumonitis, paper mill workers' lung from microbial contamination of pulp. Always rule out tuberculosis and malignancy, nasal adenocarcinoma risk with long-term wood dust, lung cancer less strongly tied but must be considered given hemoptysis. Differential discussion earns marks if you show exposure-response logic plus non-occupational causes. Control and prevention, structure with hierarchy of controls. First, engineering measures where dust suppression and enclosure, local exhaust ventilation, wet methods at cutting and processing, regular preventive maintenance. In silica-exposed sectors, wet drilling and dust suppression devices are mandated. Cite this as an analog for exam points. Administrative measures where job rotation to reduce cumulative dose, housekeeping to reduce settled dust, maintenance schedules and pre-placement and periodic medical exams with spirometry and symptom checklists. personal protective equipment, fit-tested respirators when controls alone cannot meet limits, ongoing training and compliance audits. Surveillance and compensation, notify suspected occupational disease, maintain a register, and link eligible workers to statutory compensation pathways. For mineral silica sectors, note that India's limit in mines is 0.15 milligrams per meter cube, 8-hour time-weighted average. While Raju's industry is different, this shows the national commitment to dust control performance standards. Counsel Raju, immediate referral for chest imaging and sputum evaluation, temporary removal from dusty tasks pending diagnosis, and workplace controls as above. Pause and reflect. Why emphasize engineering controls first? Answer: they remove or reduce the hazard at source, the most reliable layer of protection.
Scenario 3. A 45-year-old man from a slum area presents to the OPD with fever, chills, rigors for 3 days. While it looks like malaria, write the differential approach to such fever beyond just malaria and referral criteria.
Think acute undifferentiated fever illness or AUFI. Approach it in 5 moves. First, triage and danger signs, in which hypotension, altered sensorium, severe breathlessness, bleeding, jaundice with confusion, pregnancy, extremes of age or significant comorbidity, immediate referral. Second, focused history and exam. For day of illness, rash, myalgia, retroorbital pain, eschar, cough, dysuria, abdominal pain, diarrhea, travel, monsoon, rodent or flood exposure, unsafe water, occupational clues. Third, first-line tests as per local algorithm, malaria rapid test or smear. If negative or features suggest, test for dengue, NS1 early, scrub typhus, IgM or rapid, leptospirosis, chikungunya, and complete blood count with platelets, urinalysis, Vidal or enteric test as per policy. Indian algorithms emphasize ruling out life-threatening vector-borne causes early. Fourth, empiric therapy, which is guided by syndrome and local policy. For example, doxycycline in suspected scrub typhus where prevalent. Never delay anti-malarial if smear or rapid positive. Fifth, follow up or escalate when lack of response in 24 to 48 hours, worsening signs or organ dysfunction, then refer. Write the referral criteria explicitly. Shock, persistent hypotension, oxygen saturation less than 90%, bleeding or platelets rapidly falling, confusion or meningism, pregnancy with fever, severe dehydration, renal failure, bilirubin rising with encephalopathy, or any positive malaria with severe features. Pause and recall. Beyond malaria, the 3 common AUFI culprits in monsoon India to always test for: answer: dengue, scrub typhus, and leptospirosis.
Quick consolidation. Could you give a compare and write template?
Absolutely. Hypertension, 150 over 100. Classification, stage 2, higher category by diastolic. Plan, confirm, risk stratify, dash plus sodium/2300 milligrams per day, aim 1500. Weight loss, physical activity, tobacco alcohol counseling. Start 2 drugs if needed. IHCI target less than 140/90, schedule follow-up. Occupational cough with hemoptysis, paper industry. Likely occupational asthma or chronic bronchitis or hypersensitivity pneumonitis. Rule out TB and malignancy. Controls are engineering, ventilation, wet methods. Administrative, PPE, surveillance. Know that dust suppression standards exist nationally, like mining silica limit 0.15 milligrams per meter cube, wet drilling devices. AUFI at OPD, do triage for danger, malaria tests, AUFI panel as per local algorithm, refer if unstable or complicated, document and notify when indicated.
Last quick drill.
Let's do 4. One line on NP-NCDCS, Government of India's umbrella NCD program renamed from NP-CDCS, driving screening standard protocols and follow-up. Dash numbers to quote: vegetables 4 to 5, fruits 4 to 5, low-fat dairy 2 to 3, nuts and legumes 4 to 5 per week, sodium less than 2300 milligrams per day. First prevention layer for dusty jobs, engineering controls, enclosure, local exhaust, wet methods. 3 red flag referral criteria in AUFI, shock or SpO2 less than 90%, bleeding or platelets crashing, altered sensorium, also pregnancy.
Awesome. Today we classified hypertension and mapped IHCI aligned care, unpacked a paper industry lung hazard with control, and built a clean AUFI differential and referral checklist. Dr. Joshi, thanks for another exam-ready walkthrough.
My pleasure. Remember the rhythm. Measure right, treat simple, follow up tight for NCDs, and control at source for occupational hazards.